We'll begin our, we'll begin our skit with scene 1, Ananya's home in bedroom. Ananya lies unconscious on the floor while her mother walks in with a folded laundry humming, unaware of it.
Ananya, Ananya, oh my God, what happened? There is a note.
What happened? Ananya?
I
Ananya?
want to end this pain. I'm sorry. I think she took something. Call an ambulance right now. Ananya.
We move on to scene 2, emergency room, triage and initial stabilization. The resuscitation team stands by. Ananya is wheeled in, unconscious on a stretcher, lights bright, keeping monitors. ER nurse calling out.
Excuse me. We found this at the home.
16-year-old girl found unresponsive at home. Suspected drug overdose, GCS score 3. Vitals are HR 60, RR 16, BP 90/60, oxygen saturation 92, and pupils 3 mm sluggishly reactive.
Okay, first we will start with ABC, whether the airway is pattern.
Tongue partially obstructing, breathing is shallow.
Back valve mask, 100% oxygen. Let's prepare for intubation.
Bagging initiated, chest rise adequate.
Good. Breathing rate is 16%, O2 saturation 92. Whether is there any respiratory fatigue?
There is mild nasal flaring with shallow effort, doctor.
Okay, continue VVM, draw the ABG. Let's intubate ACD-TODH. What's the capillary refill?
Delayed.
Start NS bolus 20 ml per kg. Secure the IV access. Connect cardio monitoring and defibrillator pad.
IV secured, bolus running, and ECG shows sinus bradycardia.
Okay, draw left CBC, electrolyte, RFT, LFT, glucose. Send the patient urine and also check for the serum salicylate level. Call the pediatric resident.
Okay, doctor.
Okay, so what about vitals, stable or not?
Stable, doctor. Labs are pending.
Okay, I'll ask the PGIs to take complete history.
Okay. Parents found this pill bottle and are not decided.
Okay, this looks like beta blocker toxicity. Please keep glucagon ready.
Okay, doctor.
ABCs always come first. Ananya is stabilized with oxygenation and IV fluids. Once vitals are supported, the team moves to identify the cause and a cry for help. Moving on, our scene 3, history taking and further management. We have 2 PGI who meet up with the parent to take a complete history.
Hello, you being the mother and father of the child, we understand that this is a difficult situation, but I need to ask you a few questions to understand what's going on.
Yes.
So, when was she last seen normal?
Morning during breakfast.
Okay, was she lying in the bed, on the floor, or any unusual position?
She was on the floor and unconscious.
Okay, was she breathing slowly, fast, or like not at all?
Yeah, it was slowly.
Okay, any jerking, eye rolling, or tongue beating, or wetting herself?
No, nothing.
Okay, did you notice any vomit, foaming of the mouth, or unusual smell?
No, nothing else.
Okay, how long was she unresponsive before arriving here?
Actually, we were in rush, so we didn't notice.
Did she have any past medical problems?
No,
Okay. Does she have any chronic illness like epilepsy, diabetes, asthma, or any other?
nothing diagnosed till now.
Okay. History of any psychiatric illness?
No, he never visited a clinic or a psychiatrist.
Okay. Any diagnosis like depression, anxiety, or self-harm in the past?
No,
Does she take any regular medications?
no,
Any new prescriptions or something?
no,
Any medications are like missing at home or found at there?
We found the unlabeled pill bottle which we gave to the nurse.
Okay, well found out. Did she start anything new recently, like known drug use or recreational drug uses?
No.
Okay. Do you know if she was involved taking vaping pills or anything from her friends?
Actually, her friends do, but
she never did.
Did you notice any smell like alcohol, chemicals, or fruity odor in the room?
no.
Okay. Any cleaners, insecticides, or medications which were easily accessible to her?
We do have cleaners, but
it's still unopened.
Okay. Did she have any recent stress or trauma?
no.
Okay. Any fight, breakup, academic pressure, or bullying recently?
I thought we were too busy to notice.
What we were too busy. I am working whole day for our household.
So on.
Okay, calm down, calm down. We need to focus on your daughter first.
So the last one. Have you noticed her more withdrawn, sad, or irritable?
She's been more reserved these days.
Okay, thank you for your cooperation and we'll follow up on the case accordingly.
Okay.
Thank you.
A structured history not only guides management, it reveals emotional wounds that led to this act. Identifying a toxin isn't always immediate. In emergencies like this, supportive care takes priority, buying time while the unknown becomes known. Scene 4 is a differential diagnosis meetup. A team of pediatric residents, 2 clerks, and 1 PGI meetup to discuss the case.
Okay, so what are our differential diagnoses?
Doctor, it might be beta blocker overdose because the heart rate and blood pressure both were low.
Okay, but there were no seizures or severe bradycardia. What else?
Could it be opioids because the patient was unconscious with low to stat and also the heart rate and BP was low?
But the respiratory rate was normal and there were no pinpoint pupils, which are commonly seen in opioid overdose.
Any more ideas?
Doctor, might be benzodiazepines or barbiturates cause the heart rate and blood pressure low and also the sluggish pupil reaction.
Okay, but the respiratory rate was normal and there are no signs of going it low.
Maybe TCAs, maybe she was on them and didn't tell anyone.
There is no mydriasis or tachycardia.
And what about acetaminophen? It is easily available.
But there were no GI symptoms as such and the pending lab will tell us more. But what about Benadryl or commonly called diphenhydramine?
Same as TCAs, no mydriasis or tachycardia, so we can rule that out maybe.
We should consider sympathomimetics since they are commonly abused by teenagers.
But there is no tachycardia, agitation or hypertension seen in our patient. So for now we will keep her stable and wait for labs.
Moving on, scene 5, psychiatric evaluation. Ananya is not awake, unresponsive. One is sleeping softly. Psychiatrist sits beside her. Her parents are seated nearby, visibly anxious.
Here to talk to you, but whenever you're ready.
Okay.
I want to understand how you have been feeling.
Okay, I guess.
This feeling is more common than you think, but I'm glad you're with us now. We'll be fine very soon. Physically, she's stable for now, but emotionally, she is at risk. She'll be needing a complete mental health evaluation, ongoing suicide risk assessment, and psychological support.
We thought these are just mood swings. We never thought it would be so serious.
We never see how deep her pain was.
Pain often hides behind the silence of the adolescents these days. I would want to talk more about it.
Psychiatrist talks with parents privately for more information.
Please have a seat. First of all, I'm truly sorry you have to go through all this, but you have taken the right step bringing her here with us. Now we have to talk about how we'll move forward as a family for your child.
We had no idea. She never told anything, or there were no signs that we saw.
Sometimes adolescents these days hide their pain behind a silence or a very subtle smile. Sometimes they do not have words to express it, and or else they feel that if they try to also, the parents might not understand.
We thought giving her space was the bait and she not really opened much.
You're not alone in this. Mostly adolescents are very not outward with their feelings, and the initial signs are mostly missed by the parents, not because you're ignorant about it, because these signs are very subtle. You might have noticed her emotional numbness most of the time. She might be irritable. She must have so many mood swings in the whole span. And you might have noticed her academic performance decline. There must be some food appetite changes or her sleep schedule changes. So these are some subtle signs.
Yeah, I noticed some of these, but I thought they are normal and it was not that serious that she will move to this much.
It's okay for now. We'll actually see what's beneath the surface. Eventually, when she's ready, we can take help from therapy also. Therapy will help her process her feelings more safely.
We just want to feel her safe and know we are here no matter what.
Trust me.
Yeah, we will do everything we can and to make her feel safe and better.
Of course, that is the most generous amount of help it is given by the parents. She must feel that she's not alone. Her voice is heard, and sometimes healing does not require complete perfection. It just requires your presence.
Yeah, we will do.
Thank you.
Thank you, doctor.
Support after a suicide attempt doesn't begin with answers. It begins with listening, validating, and showing up. Healing is possible, and families can grow stronger through it. We have a table for common toxin and the antidotes. Moving on. In every emergency, we rush to check vitals, but emotional wounds don't always bleed. This is not just a case of poisoning, it's a story of pain, of silence, of a cry unheard. It reminds us we must look, listen, and act before it's too late. So, everyone, let's listen, let's care, let's stop. Mental health matters. Thank you so much.